morning and welcome to the show. The topic this morning is the Black Health Care Task Force. And we're talking to two members of that Health Care Task Force this morning. Our first guest is Attorney McDonald with the Department of Health and Environment. And of course, to Mr. McDonald's left is Reverend Dr. KRobinson from Vanderbilt University in Payne Chapel, who's also the chairman of the Black Health Care Task Force. And let me welcome both of you to the show this morning.
Glad to be with you.
Good morning.
Mr. McDonald, what we'd like to do, and of course Dr. Robinson will respond accordingly, is to talk about health and wellness. What are some of the problems before we get into the specifics of the report that was issued recently by this committee? What are some of the problems dealing with wellness and health, perhaps in Tennessee and perhaps throughout the nation?
Well, on a national basis and also on a statewide basis, the federal and state governments have recognized that homicide and chronic disease, cardiovascular disease, infant mortality, and basically a lot of considerations which deal with healthy lifestyle, health promotion, healthy choices, really have made a disparate impact upon minority communities, and in particular black communities. And in Tennessee, the State Department of Health and Environment has tried to put in place specific programs targeting these high-risk populations. What we've seen, at least since 1986, which is when the Black Health Care Task Force was created, has been efforts to take on what we call innovative approaches to deal with these high-risk populations. Homicide, as we found out recently from a report that you just spoke about, narrowing the gap, homicide is now the second leading cause of death for African-American males, second only to accidental death. Black infants are twice as likely to die by the first birthday in comparison to whites. We've also seen this disparate percentages when it comes to hypertension, when it comes to heart disease, when it comes to diabetes and stroke, and all sorts of different medical problems, which Dr. Robinson will speak to, which really deal with healthy choices, healthy lifestyles, the decisions that people decide to make about dietary patterns and exercise, environmental problems, especially when you talk about exercise. And again, the Narrowing the Gap report really, as an information tool, discusses not just the problem, it also talks about and gives some insight as to different agencies and also maybe some efforts on the part of other units of government as to how these problems might be addressed. I might add that, for example, if an African-American female is lucky enough to reach age 65 or 70, she is 3 or 4 times likely to die in a house fire than her white female counterpart. Again, these all relate to education.
Health and well-being.
Right, health and well-being.
Dr. Robinson, looking at that from that perspective, why don't you say something about your situation as the chairman of this Health Care Task Force that issued this report, Narrowing the Gap? Bring that in with as much information dealing with health and wellness as you possibly can.
Certainly. We surely appreciate the effort of the Tennessee Department of Health and the initiative that was taken by the department in 1986 to look specifically at the health-related concerns of African Americans in Tennessee by establishing the Black Health Care Task Force. For the last 5 years now, the department has been looking for input from those of us who are both internal to state government and those of us who are external to state government and in the private sector to give some leadership and some measure of advice and recommendation to the department in specifically targeting issues that affect the health status of African Americans in Tennessee. Specifically, the task force has been involved in the challenging task of looking for programs which could serve as model demonstration programs, attacking some of the variables that Mr. McDonald has just recently identified as adversely and disparately affecting African Americans. Over the last 5 years, we've looked specifically at some issues which have included chronic diseases in African Americans, the homicide rate in African Americans, the tremendously high proportion of low birth weight infants, and the resultant disparate percentage of infant mortality rates for African Americans when again compared to their white counterparts. And for the first 4 years, the task force looked at projects that specifically sought to alter the statistics from those model demonstration projects when compared to control groups or the more traditional route of health care for African American Tennesseans. More recently, the department has launched a very a visionary, I believe, and appropriate holistic approach to black healthcare issues, saying that really if we want to get at the precursors to those endpoints, those problems, the chronic disease, the end-stage renal disease, the end-stage heart disease, the cerebrovascular disease, the stroke, if we want to get at the precursors to what leads to low birth weight infants and higher infant mortality, if we really want to begin to get at the questions, why are our young African American males killing themselves much more frequently than their white counterparts, then perhaps our model demonstration projects need to move a little bit more proximally to those endpoints. And so for the last year and a half, we have been, as a task force, advising the commissioner, and we're very grateful for the kind of leadership our commissioner has given to us in following some of the recommendations to look more holistically. What is the status of the individual as he or she relates to the family? What impact does the community have on the life and the health promotion and the disease prevention aspects of that individual and the individual's family's life? How should some of the other institutions in the community, the church, the schools, become proactive in hoping to change the precursors to those endpoints? And so now, as the chairman of the task force, I have the challenge and the task to look at projects which are much more holistic, not just looking at individual endpoints, but projects that seek to alter the values, the life decisions that young people have and make.
Very good. How successful have we been, Mr. McDonald?